see it now. Cool.
No, I'm not. I'm on the screen. The switchboard is giving me a warning here. Okay, actually we are live. All right. In that case, we are live. So good afternoon. I am going to open my PowerPoint. Just to get the confirmation on the PowerPoint. All right. Good afternoon. This is United Medical ACO. I'm Kemal. I'm the chairman of the program and the ACO here in Delaware. This is our weekly event live session. Several different reasons that we are doing this for. And one of whom is to inform our patients mainly. They don't have to be patients of ours. Anyone who live in Delaware or anywhere in the world, they can actually benefit from what we are doing. We are providing information that's needed for everyone in every part of the world. So today we are going to discuss three topics. I have Tanner with me from our business development team, and Tanner is gonna help me with the digital data, digital record part of the presentation today. We'll have a conversation on what we are doing from United Medical. And then I'm gonna actually start giving you the updates from COVID with the record high numbers in the last 10 days, a lot of concerns. And also a couple of the articles that I thought it would be beneficial for everyone to read, and we are going to summarize. One is from American Medical Associates, and the other one is from an interview with Dr. Fauci. In terms of our total numbers in the United States, as of today, we have about close to 250,000 deaths. This is almost 11 million confirmed cases. So we are actually going through record high numbers. And I'm going to actually just bring my the actual live data from Worldometer so that you can actually see. And then, please don't judge me for the advertisement. I have nothing to do with that. Here is the numbers in United States. As of this morning, it's already at 18,000. Now, what I would like to point out is what happened yesterday. That was 161,541. This is the highest number, I believe, right, Tanner? So we never had that kind of number before. And then from the 2 days ago, that number was at 144,391. So the way we can manage this is, of course, challenging, and it becomes a bigger challenge. Now, one of the concerns that I have is the way that we are, our approach these days. Like we got used to it, and the numbers are increasing like at a crazy level, and we are not really changing our approach or our attitude. So we do want to make this very clear to our patients, to public, so then hopefully we can make an impact in your life in a positive way. So from the Delaware numbers, right now, the total hospitalization is rising up to 130. And then the percent of persons testing positive is also over 7%, which these numbers we have now. We have our ACO numbers, which are higher than this. So remember, this number includes a lot of patients with maybe no symptoms, and so it's low, and that's the reason for that. However, when you look at these, in fact, what I would like to show you. I want to make sure that I don't risk the live data because it's in my office computer. So let me just show you what actual data from an ACO standpoint, so you'll understand. Now, I feel I feel guilty when I tell you the percent of persons testing positive 7%, when from our ACO, which we have a very good process to get these patients follow up and getting them results done. And what I'm gonna show you is gonna tell you the actual percentage from a clinical setting, not perhaps from the public setting. Now, as you can, the complete data we have here. So I'm gonna just the week of this 11/2, we were at 14%. So this is from the ACO side. Now, one may say, well, because patients are ordered from the ACO, from the physician practice, that's because they have more symptoms, so there may be a possibility of those patients being sicker is high, true. However, that's what we are worried about. So this is a pandemic, and it's going to go from one person to the next. And our number is, I would say our number is the right number. Or perhaps you can take an average of it. So, but it's not 7%. So that's what I'm trying to tell you. We have, Tanner, how many patients we have seen in the last 6 months? Would you say it's over 90,000?
That sounds correct.
Right?
Yeah, that sounds
so
correct.
In that, we are making sure that our goal is not to scare anyone. Our goal is to give you most accurate data so that you can make an intelligent decision from this data. You don't need anyone to tell you what to do. You need to be given the right information from the places like ours, the state, the federal offices. So, and then you need to make your own conclusion with this. Now, from here, I'm going to have Tanner to cover the digital health, which becomes the, there's always a good, some good outcome of the crisis that we go through, what we can learn, what we learn, and what we can quickly adapt and change. And I believe digital health wouldn't have this much improvement if we didn't have a pandemic. So Tanner, if you can tell us about what's going on that side.
Sure. Thanks, Kemal. We might just want to make that one real quick.
So I just need to, okay, go ahead.
Thanks, Kemal. Sorry, just cut. Thanks, Kemal. So, as Kemal mentioned, my name is Tanner. I'm with the business development team here at United Medical. And I think you put it really well with the mentioning that there was a silver lining here, an opportunity that we saw with the onset of the pandemic when it comes to our digital health and our digital resources for both our clients and our patients. So just a little bit of background with our digital health programs that we've been really focusing on and working on promoting with the onset of the pandemic it really started with a necessary, we knew we needed to kind of maintain the level of patient care. So we were able to quickly transition into the telemedicine period. So making sure that we had our practices best equipped and set up to be able to provide the same level of care, whether it be still having our patients at home, maybe our providers then were also working from home, just making sure that we were best equipped to keep everyone safe and out of office while still continuing that same level of patient to physician interaction. So we really got off the ground running with that pretty quick. We're able to adapt our practices to be able to successfully have the telemedicine visits. And at the same time, we realized that there was a communication aspect there with our practices that needed to continue and to grow. As you We have been in the past having regular UMACO meetings with our providers and our clients, so this was something we were holding in person. So we knew that this was going to be something that we wanted to maintain, that we wanted to continue. So the staff here, the executive staff, started to figure out that we can take this meeting and we can hold it virtually, we can hold it online, and hold it regularly. So we were having this level of meeting almost every night. If we were having it every night with our providers at the onset of the pandemic. So we really saw this as an opportunity we can communicate this information with our clients and our physicians. How can we really take and continue and get information out and the resources out to our patients while we want to keep them at home? Similar to telemedicine, if we're keeping them at home for visits, how can we continue to provide them with education, tools, and resources to really take advantage of their own health? So currently, as we see right here on screen, we got a couple different resources that we have implemented and are starting to really promote. So this starts with the telemedicine side. We have a video platform with Cerner where patients, if they're registering for the IQ Health Portal, which is something we've discussed numerous times on here, how it's really a great tool for patients to be able to take advantage of their own health. They can communicate with their physician. They can request appointments. They can now even have a telemedicine visit as we're starting to work to roll this out to more and more of our clients. And as I was kind of speaking on with those meetings that we were having with our physicians, we wanted to kind of take that same format then and kind of present it to our patient population. So whether you've been a long-time patient of one of our practices, or maybe you're a new patient with one of our practices, you can all come to our Facebook pages and our social media channels and find valuable resources that you're going to get from the physicians that you normally would be seeing in person. And maybe now you can get that same information from the comfort and safety of your own home as we're still going on. As Kemal had mentioned, pandemic numbers now that we're seeing that we haven't seen since the beginning. So now more than ever is a great opportunity to take advantage of some of these resources as Kemal goes over numbers and updates for the state, as well as we have physicians from the ACO come on and discuss how the pandemic has really affected their practice and how they're adapting and moving forward to still be able to deliver care to our patients. So we see this with the ACO on a whole level. We're continuing the same format with our diabetes groups, with the wellness webinars you can find on Wednesday nights, as well as the CREAS bariatric surgery journey webinars. So if you're a patient that's going through the bariatric process, or maybe it's something you're considering, that's really a priceless resource to have on there, where you can see and interact with the physicians and our bariatric surgeons as they discuss the process, what to expect, and how you would end up going through that as a patient. So we have all kinds of different events and platforms that we're really starting to develop and making sure that we're getting the best resources out to our patients.
So I think a couple of the places that we are going live, it's having some technical issues, but because we had this new sites added, so it's okay. So because the meeting is recorded and it's going to be on Zoom, and we'll be uploading it. So in case those who are not able to see the event, but I know that on the Facebook side there shouldn't be any issues, but the YouTube will be. I just got an error message from the switchboard. You know, these every week we are trying something different and trying to improve what we are doing. Usually the Friday meeting is the one that we take a little bit more risk. And that's part of our learning. And I just realized that my sister is not listening to me because she was calling me. And I know that Susan Anderson was not listening because she came to my office and then she was surprised. So, but I'm glad everyone else is watching. So the events that we have, this digital health part of it, Tanner, from the telemedicine side, in terms of the total appointments we have done between the last year same time versus this year. Mm-hmm. So we were able to keep our patients home. What this is telling me, 35,000 from last year and 35,000 from this year. I believe that was a 2 or 3 weeks data, if I'm not mistaken.
Correct. So this is looking
So
at
I'm
the
sorry, this
entire
is
month of March.
my bad. So this is March. First line is the March, and the next one is the June.
Yes.
And even after after we go into the fall, we didn't actually change the total number. So which is helping patients being home, staying home, and that's one of the reasons that we added so many live sessions, educational sessions. So there is a team of us here who are actually keeping these content. I wish it was just easy to come out and just talk about it, but it's not. So we try to put something meaningful. For the bariatric side, we have live events once a week. And then from the United Medical ACO wellness program, we have twice a month. And then I do these with different guests every week, except that last week we didn't do. So please take advantage of these. So what I'm going to actually go from here is, so let's stop sharing the screen for a second. And so like, Tara, actually, I do want to ask you before we go into the next, like, this is your first job after college, right?
Yes.
Right. So,
That's correct.
so it's been what? How long is it?
Since May of 2019. So I've been here since August.
Okay. So you're in your second year. So
Yes.
you're in the business office, but you do a lot of clinical work as well. I mean, from the educational side, providing training, providing content for these meetings. Now, from a young person standpoint, what does this do in your life? Like, how do you cope with this?
Well, that certainly was tough to begin with, as it takes a large part of course, like your social side of your life out of your normal everyday routine. So I think at first it was really difficult to cope with having a very abrupt change of lifestyle, and really being kind of more so secluded to a certain area or maybe a certain small group of people. But I think that the adaptation and going back to more so of like the silver lining side of the pandemic has really had a benefit for me, both at home but also here with United Medical, as we're seeing just, okay, here we're presented with a problem. So now what can we do to continue what we were doing, but not just continue how we were going about day to day, but how can we improve upon that? How can we make that better? So I think that while it's been a very adverse challenge to both at home lifestyle and every day-to-day work, it's also been a really interesting time in my life, being that it's really, I mean, for both of us, we've never experienced anything like this before.
Absolutely.
So it's not like there was any clear-cut answer as to how we're going to go ahead and progress as an individual, but also here at United Medical as a company. So we were really facing a very profound challenge. And I think that I'm really excited about what we have, what we're doing, and going forward. We know the pandemic's not going to go anywhere anytime soon. So as much as we like to say go back to normal or how things used to be, I think really what we need to be doing is keeping an eye going forward, and how can we keep progressing, and how can we keep making sure that we are rising to the challenge and kind of making sure we're going to be best equipped going forward and coming into the new year and coming out of this pandemic. How are we going to be able to really make a difference in ourselves, but also like when coming back to United Medical with our patient population? How are we going to make sure our clients and everyone are best equipped going forward? So I think that from my perspective has really been my biggest takeaway. From this.
No, that's really good. I mean, for this, because this impacts the people in a different way, and for us to really manage the crisis in a way without losing control. It's important for us to have everyone at the same, from different levels, from different angles, to be on the same page. And you're right, we are at United Medical, we were lucky to have a great team to manage this, not only from our business, but for our patient standpoint and for our medical practices standpoint. Now, Tanner, I shared these two articles with you last night, just so that we believe that this is helpful. We are going to make these articles available. We did not write them. These are one from American Medical Association, and the other one is with Dr. Fauci. So let's actually go through those together. Now, I find this one interesting, the 7 things doctors wish patients knew about holiday gathering this year. Now, this year is underlined, probably should be underlined. So what's different for us this year is the risk, obviously, and then again, the numbers are extremely high. So I don't, like last night, we have a provider meeting, which we do twice a week. And because I repeat this on a regular basis, weekly, daily, at some point I feel like maybe the way that I say it needs to change, or we have to say it differently, or people need to say it differently. Different people need to, it's just like crazy. I'm like, how can I make this so clear? That, now I want to just tell you, many of you the patients wouldn't know, but my people, I was one of the first COVID people in the office back in April. So I'm hearing my people laughing, and that's great. So I hope they're not laughing at my COVID, but so I think it was March 26th. I may be wrong, a couple days. Since then, I have not been in any social gatherings. And this is zero exaggeration. Maybe 10 or 12 times in the last 7 months, I played tennis with one person, and that's about it. So that's what my life is. So we don't need to play the victim. So everyone is suffering, but we have to make right decisions. So that's why I'm trying to make this like, please hear what's going on, because the holiday is a great thing. Thanksgiving is a great time to get together with our families, but can we control this and then still live our life? And I believe we can. So, and then here's this article that talks about what the doctors expecting our patients to do during this time, knowing the risk is rising, the quarantine for 2 weeks when it's needed. I'm assuming that this is before and after type, and take care in getting there. So like if you are using transportation, public transportation, what's happening and how you are handling the situation that may be out of your control, so you have to take extra cautious. So I guess maybe the safest way, I'm sorry to say this, but maybe safest way is traveling with your own car rather than public transportation. But I know that it may not be possible in some cases. Now, consider risk of staying with family. Now, this means if you are able to stay, still get together, but maybe not stay in the same place, or hopefully families have bigger homes. But we have to really, like, if it's just 1 year that we don't do this, it's not the end of the world. So the life expectancy is increasing. So, right, so we don't have a problem for losing 1 year or adjusting for 1 year. So you don't have to have a 25 people Thanksgiving dinner. Just have it with your immediate family. You don't have to bring older people into the setting that they are at more risk. So that's kind of like the expectation that we hear from the doctors based on this article is also agreeing with that. Pay attention to lodging, sanitation. So if you are staying in places, again, you are going to be always at risk. It was tough for me to not attend some of the social gatherings, including my lovely assistant Anne's daughter's wedding, but I had to make that choice. So it's not because I didn't want to go, but I just didn't want to risk, because we are coming to our office. We don't expect any, in-person meetings in our building from the clients or from the vendors. So it's just our employees, but we have to keep in charge of the situation. As I mentioned, with the limited number of people, gather outside if possible. So, many of you know Dr. Ergao because we do a lot of sessions with him on the bariatric side, and I meet him once a week. And as of last week, still we are meeting in the patio. So this is a true story. I'm not making this up. So we are. When he goes into the house to use the bathroom, he puts his mask on. Well, there's no one in the house, but he wants to, he doesn't want to get out of that habit. In some cases, it's all about the habit that we have. So again, the mask is the distance. Like when Tanner is in my office right now, although we may see us from two different angle, but we have, he had his mask on until just now, but we still have more than 6 feet between us. So this is a serious issue. So let's keep simple things simple. Let's just do the simple things. So wearing mask and keeping the distance is not difficult. So now I'm gonna ask
Kemal, if you don't mind, actually, I think that's a really good point. A lot of these things are things that we've kind of known can be preventative throughout the entirety of the pandemic, but I think a big reason that we're starting to see some of these number spikes now is just because of that lax behavior. So, right, we've been through this for so many months at this point, but that might be a cause as to why we're seeing a rise in case spikes. But if we want to really do return to some kind of sense of normalcy, I think now more than ever is going to be the best time to keep reminding people that these types of things are the best preventative measures. It's just keeping your distance, making sure you're wearing your mask. And as we get into the holiday season with bigger gatherings, that's still been a thing that we've been told to kind of avoid thus far. So that's just because we're going into the holidays, not necessarily going to change it. So it's not, of course, it's not easy. Of course, we all want to get together with friends and family, but I think that you make really good points that these are the things that we still want to make sure we're passing along and letting people know that these are effective measures. So,
absolutely. So now I do want to share one more article with you. It's an interview with our maybe like he's not so lucky that he has to work with so many different people, but Dr. Fauci, I personally do love him. Regardless of which side he's on, he's a great guy. He has done so much. Managing this type of crisis is not easy. And especially when the politics are involved, clinicians to be able to do their job, it's almost impossible in some cases. And Dr. Anthony Fauci is one of my favorite people these days because he was able to keep things together for us and then just give us guidance and directions. And this interview was just the forecast from him for 2021 for COVID-19. And I do believe that what we learned from him is that the way that we are treating COVID-19 is a lot better. Yes, we have higher numbers, but we don't have a higher mortality rate. So we are able to do more in terms of the improvements of the patient, which is really which is really good for us. So, and One of the other point that he's making, the death rates fall as the patient gets younger. So we knew this from the beginning, but I think that when the numbers are so big, are we expecting same number of same ratios with the death cases? And that's not the case most likely. And he also do believe that there are some other symptoms beyond what we can expect, the post-viral syndrome. So between the flu season and altogether, so let's pretty much he's just kind of giving us this warning. So like there are one with the cardiologists reporting asymptomatic patients, and it's going to be how we are managing this is a lot to do with how the public is approaching the issue. Like the doctors are not going to make you they won't fix the issue they won't fix the issue overnight, right? So it's the patients that we have to go through and listen and follow the guidance. So it's not just the doctor. It's not a magical work. Unfortunately, it's not. Even with the vaccine, that's the case. So this is Dr. Fauci as the super Fauci. So I did steal this from Google. I hope you won't get in trouble. Even if you do, that means Google is watching us, so that's a good thing. So the vaccines are there. There are 6 of them are on the phase 3 trial, and 2 of them that we know with the Moderna and Pfizer vaccine. So the big difference between the 2 is Moderna is 1 vial, which makes it practically easier for physician offices to store the vaccine, because if you have to do 2 vials like the Pfizer vaccine requires, then there are certain requirements that we are not yet ready in the outpatient practices yet, which we are implementing, but some of them are extremely high technical requirements, which we do believe that there are some concerns with that. As long as he keeps his job, and I'm hoping that he will. He did say that he actually had he worked with 6 presidents. And so Mr. Biden will be the 7th, I'm assuming. So we have to listen to this guy. So this guy is a good guy. This guy is Dr. Fauci. So, and you can listen to me as well, but listen to him on the clinical stuff. This is more about how the vaccine is going to be distributed, and who wants to take the vaccine first, and all those technical issues that that's going to be a problem. So we have to really be smart and follow the clinical guidelines, clinicians, and hopefully we'll come out of this. And then I will share these articles outside of this video. It will be on on our social media accounts. So feel free to read them, and feel free to send us questions with these. We want to make sure that this is more like a dynamic dialogue that we are having, and we're hoping that this is helping. Now, next week, we have 2 events, one from our bariatric program. The one at 6 p.m. is with St. Francis. We are the program director. Dr. Gail Wynn is the program director from CRIAS for St. Francis, and that weight loss webinar is going to be at 6 p.m. On the same day, next day, Wednesday the 18th, Dr. Isaiah Erga and myself, we have our bariatric live session. We start getting into the patient perspective and sharing actual real data, like 3-4 patients, and then just show you the progress on those patients. We did one just this past Wednesday. So we are going to do more of those on Wednesday. And also that night from United Medical, we have a wellness program with our dietitian Amy and Donna Gankul and myself, and we'll have a couple of guests. And that event is at 7 p.m. on Wednesday. So
6 p.m.
6 p.m. I'm sorry, this time, thank you. This time it's actually at 6 p.m. So now, as I was going through the events, it seems like if you are like a TV channel. So because there are 4 events in 1 week. Now, what I want us to focus on is, again, what Tanner covered in the beginning, why we are doing it, what forced us to do this versus now this is our choice to do it. We believe that this is the right way to support the missing information for our patients. So that's the goal. And I, as the chairman of United Medical ACO, I will do everything in my power to make sure that these events are part of our weekly discipline. And then we are, in some days, we have some issues with the content or the guests not showing up. Those are, of course, are going to happen, but we are planning to keep this for our patients on a regular basis. When you go to our YouTube channel for United Medical or for CRIAS or for my personal one, you would be able to see a good playlist of all these events all together. And we break them down to different topics, so it's easy to navigate. And we are here for you. So we have to go through this together. Please be patient and stay safe. And we'll see you next week with the 4 events that we have. Thank you so much again. Bye-bye. Tanner, I didn't ask you to say bye-bye, but
Thanks.
Have a nice weekend, and we'll see you next week. Bye-bye.